Hello, Doreen here, your yoga teacher. Do you have stiffness in your low back? Do you have achiness in your lumbar spine area? And third question, are you taking this serious enough? Meaning, are you doing something on a regular basis to release the pain and tension that may cause the lumbar spine pain? If not, let me show you why you need to do something. The most common cause for tension in the low back is the tightness of a muscle called the psoas. The psoas attaches from the lumbar spine, or lumbar vertebrae, number 1 to number 5. So L1 to 5, you may have heard it before. It touches to the body of these vertebrae and then comes to the front of your hips, and then attaches, wraps around here to the front of your hips, and then attaches to called the lesser trochanter that's here on the inner part of your femur bone. It's quite impressive, yeah? So the muscle attaches underneath your organs to your spine, comes to the front, crosses your hip joint, and then attaches here to your inner thigh. So the job of this muscle is to flex, meaning when your feet are not fixed, it will pull the knee closer to your chest. So this is sitting, this is walking, maybe cycling, yeah, or jumping onto your surfboard. So most of our activities in our life require us to flex our hip so that we can walk forward and not backwards, right? So it initiates, this muscle initiates every single step you are taking. And the bigger problem also is when you are sitting, it's not even being used. It kind of hangs out there, and now you're sitting there for 8 hours doing your work, and the muscle gets shorter and slack and slack. And then at some point you need to get up. So you try to extend your hip again, and you're like, ooh, that really hurts, because now this short muscle pulls from the front on your lumbar spine. There's the tension. That is already problematic, but if you do not take care of this pain soon enough, eventually it will lead to something worse. Things like bulging disc, ruptured disc, yeah, not reversible anymore, or things you may have heard before, spinal stenosis, scoliosis, where the spine goes to the side. So let's not wait. Let's not wait for irreversible structural changes to occur, and learn how to stretch this muscle. So this is called flexion of the hips, i.e. hip flexor. So what are we doing? In order to lengthen this muscle, we need to extend the hip. That is hip extension. Fairly easy, right? That causes the problem. That fixes the problem. But there are some little intricacies, how to align the rest of your body, how to use your muscular action in order to provide enough support, integrity, and also respect for yourself and your muscles, so that the muscle is actually willing to lengthen. Otherwise, you're just pulling on meat, and that will kind of make your hip flexor even more angry, and it gets even tighter. So that's why I created this video for you. It will be in the comments. You'll see on how to release this muscle with care and actually make sure it's effective. Yeah. So let's go. Click on the other link and I'll show you how to do it.